soul lies down in that grass, the world is too full to talk about language, ideas. Even the phrase each other doesn't make any sense. That was Rumi in the 13th century, 14th century. Things haven't changed, have they? Oh, right. Okay. Can you hear me now? Yes. Well, it's lovely to be back among such good friends and new friends, I hope. I was delighted when Michelle and Tim reached out and asked me what I'd been doing all these years. Well, I'll give a very brief intro to who I am for those who don't know me, which is a new experience for me because my work is without ego. So it's very nice for me to just talk about myself for a bit, which I find unusual and a little uncomfortable, I have to admit.
Hello.
Begin at the beginning, go right on till you come to the end, and then stop, said Lewis Carroll. As a kid, if ever I was poorly and my mother came to my bedside to nurse me, I would say to her, "Mum, I can feel you before you touch me." And she'd say, "Oh, really, darling?" Obviously, the feature of a diseased mind at the time. But when things were happening in the family that were tragic, and my grandmother was in despair and desperate for help, the doctor prescribed her with uppers, downers, sleeping, waking up, everything they could throw at her, electro whatevers that cooked a lot of her brain so that she became quite damaged. As a child, I just thought there must be another way. There has to be another way. Thank goodness the medical profession has moved on a lot since then. I'm talking about my grandmother, and I will be 80 in December. So we are going back quite a way. Historical or even hysterical, if you like. So I decided that that psychology was the way forward for me. I got my degree in psychology. I wanted to be an educational psychologist, which involved teaching throughout the age ranges and ability levels before I could be accepted into the course that I wanted. And luckily was accepted onto the course that I wanted. And so for many years, until from when I finished my postgrad in 1972, until the mid-80s, I was an educational psychologist, first in Surrey and then in the Inner London Education Authority of blessed memory, until the Thatcher administration, in their infinite wisdom, abolished one of the finest education authorities in the world. At which point I had some medical issues, thank goodness for the medical profession, and was allowed the luxury of turning down a couple of very interesting jobs that were offered to me that I hadn't applied for. and taking the time off. And then I thought I would establish my own consultancy and let it be known to all and sundry who had any capacity to listen, that I would like them to shovel in any waifs and strays or people in need of therapeutic help. Into my life, quite early on at that point, came a lovely young woman who is now living in Australia. She had some emotional issues to sort out, and she, at that stage, I wasn't in my practice in Harley Street. I was working from my front room, we had a cat, a beautiful little cat, and I'm going to show you all. This is what's called an audio-visual aid. Meow. This is her mother, Moonbeam, and this is Zizzy. Now, Zizzy, at 9 years old, had been told, well, she'd been told, but I'd also been told, and my husband had also been told, that she had 2 or 3 weeks at the most to live. Her kidneys had gone into free fall, and when the quality of life became intolerable, to take her back to the vet, and he would end her life. We were heartbroken. She had a personality as big as all outdoors. She was a wonderful little cat. And if any of you, how many of you have animals at home?
Yes.
But they're part of the family. They're very important parts of the family, and it was very sad news. So my lovely client walked in for the first time through my physical front door, and also through into my life. Zizzy woke up from her semi-conscious stupor and looked at my client and went, wow, and followed her into the lounge. We sat down in our armchairs. Before she sat down, practically, Zizzy was on her knee. And I don't know if you've ever had a conversation with a Siamese, but they can be quite intense and their eyes are quite crossed. And she was practically shouting up her nose, wow, 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 and she was talking to her as with the language that she used for Nick and I. She had 2 languages. She was bilingual. She had a language for visitors, which was very polite, and she'd wait whilst they cuddled her and stroked her and told her how beautiful she was. And then she would absent herself very politely and go off to do far more important things. But Zizzy was using family language with my client, and she stroked her. And I thought to myself, I have been a consultant educational psychologist in a consulting suite in Camden, and I'd never had this challenge with my new client. And so I said to her, I'm terribly sorry, dear, should I take her out? I'll take her out. No, she said, no, I love cats, and she's particularly beautiful. And she started to stroke her, and she got down to her kidneys, and she said, whoa, do you know she's not well? Of course I knew she wasn't well. She said, do you mind if I work on her whilst we talk? The cat was saying, don't ask her. She doesn't know anything about this. You just get on with what you're supposed to be doing. She said, has she seen the vet? What does the vet say? So I explained. Kidneys, right. She said, okay. And we talked. She healed the cat. And she, at the end of the session, she thought it would be useful to book in more sessions. She was a busy woman. So she booked in different days, different times of different days. Every time before her session, about 3 or 4 minutes beforehand, Zizzy would be at the storm doors looking through to the front door knob, waiting for her session. She knew that my client was coming for her. This went on for a good few sessions until my client was very happy about the way she'd sorted her challenges in life. And throughout, she would say to me, I don't know what you're doing, piddling around on the surface with words. It's all very well, but you should open to it. You've got to get on with it. What are you doing? Just open to it. And I said, well, how do you open to it? I'm sure everybody in this room has their own stories about how they were either drawn into direct spiritual healing or Reiki or medicine. But this was my story. I said, well, I don't think so. I can see you've got something special, dear, because there was one particular session that very notably where my client went, whoa. I don't know what happened there, but there was quite a catharsis. And so the cat, having sat on her knee throughout all the sessions, in the middle of this session, jumped off her knee, went to look through the French windows, looked at her watch, consulted her diary, things to do, places to go, people to see, and off she went. She was perfectly okay and lived to a grand old age of 15, which is the same age as we had lost her mother, Moonbeam. I had to accept that my cat and my client were far wiser than I was. And I've been learning ever since. Having learned ever since and explored all sorts of ways that subtle energy manifests itself and can be used in well-being. One of my ex-clients became first an assistant and then a very dear colleague. We decided to do a research project, and I might talk about that later if there's time. But we got lovely results, and so we decided to write a paper and present it to the World Federation of Mental Health. And with it being the World Federation of Mental Health, it was an international congress held in Dublin. And so many people from around the world came up to us and said, how do you train? How do you get these fantastic results? And we said, well, we've developed it, and there's just the two of us at that time, the lovely Adriana Peñalosa. And so at the back of an envelope, sitting in Dublin on the way to catch our plane back to London, we just flashed out what we would do if we were to train people. And this is what we listed: training in hands-on and distant healing, the basics of systemic psychotherapy, sound and light healing, mechanics of I'll say that again with my teeth in, manifestation, law of attraction, constructing guided meditations, introduction to electrobiology and biobiology, soul journeys and working with visualizations, past life regression, epigenetics, introduction to Oriental esoteric ideas of harmony of energies, Feng Shui, I Ching, and so on, creating sacred space, First Nation American basic elements, introduction to Ayurveda, happiness, introduction to the principles of human-given psychotherapy, introduction to the principles of neuro-linguistic programming, NLP, the use of oracles, introduction to quantum physics, the ideas of entanglement, clinical research into healing and other subtle energy phenomena, telepathy, interspecies communication, remote viewing, introduction to reverse speech technology, and ethics and professional practice. What would we call a course if we were to use this as the basis for our training? And we call it soul therapy. It's a 2-year course. It's 2 hours every fortnight in the evening. The first year, we try and cram as much of this in as possible, and encourage our students to enlarge on that. And I have 3 wonderful people here who will hopefully talk about how they have used what we've been working on with them. And the second year is professional practice, how we combine the subtle energy and the healing techniques with conscious level therapeutic techniques, because people need to make sense. We're humans. We have to make sense of what we're experiencing. We have to draw meaning. And so it's essential that we are prepared to join them in that journey of exploration. And so I think probably my brief strut upon this stage is coming to an end. And I would like to invite my beautiful colleagues, my graduates here. And if a little pause for adverts. Thank you. And thank you very much. I'm very honoured that this lovely group has been, and is, I hope, interested in the work that we do.
You're going to sit here. Maybe. Hello, I'm Denise, and thank you, Ingrid, because that was a lovely introduction. In fact, you've taken away some of what I was going to say, but that's okay. That's what happens, isn't it? But before I speak, I would like us to do something which we did every time we met with Ingrid. The first year was on Zoom because of lockdown, and then the second year, but every time we met, we did a very short meditation. And I would like it if you would be willing to try this with me. It is very short, so you don't have to worry about it. And I'm sure a number of you have done meditations before. And this is similar to the one. So if we could have our feet on the ground and sit up straight. And start to feel the energy of the earth connect. I know we're 1 floor up, but it's just that sense of coming to stillness. And I'd like to take a deep breath in, breathing all the way down to your tummy, and then breathing out. And take another deep breath in right the way down to your toes. And then breathing out slowly. And then take a deep breath in to the top of your head. And breathing out. I'd like you to imagine walking through a field of many colors, and it's beautiful. There's a sense of peace and quiet. And to walk through and to feel your senses. And then in the distance, you'll hear some water. And walk down towards a little gentle slope towards a river. The river is sparkling and clear. And you're going to step into the river. But you're not going to get wet. And you're going to walk through onto the other bank. When you get to the other side, just feel the lightness and gentleness. And we come back to the space, and when you're ready, please open your eyes and return to this room. I'd like to tell you a little bit about myself, as this will help you understand more clearly why I chose to expand my knowledge and accept another way to work alongside my current work. So for the past 25 years, I've been working as a psychodynamic psychotherapist, counselor, trainer, supervisor. Prior to that, I was fortunate enough to have trained as a homeopath in my 20s, which is a long time ago, but a shiatsu practitioner, been a manager at an advice centre, and I've run a project for the over 50s on behalf of Barnet Council and Age UK for the health and welfare, setting up lots of different projects within it. I had 22 Tai Chi classes, some of them working in closed mental wards at Edgware Hospital. And prior to that, I worked for 16 years in the media and the press as a picture editor, researcher, stylist for major newspapers, TV, magazines. So it's actually been a life of curiosity, change, and being open to new possibilities. So running as a thread throughout all of this has been a meditation practice, thinking about how silence and noise has affected me as a mother and as a wife and as a daughter. I've been on my own now for several years. So it's been an opportunity to explore the workings of spirit a little bit more. And to think about how the spirit and the divine is, how can I bring this actively into my life? So I know everybody knows about Rudolf Steiner and how he understood all the arts can be used in the art of healing with his anthroposophical medicine. And he believed that if they are properly integrated in the life of the individual, they liberate creative powers and they help self-knowledge. And he believed that humans once participated more fully in the spiritual processes of the world through a dreamlike consciousness, but have since become more restricted in their attachment to material things. So the renewed perception of spiritual things requires training the human consciousness and helping it to rise above attention to matter. Thanks to the internet for those words, but I just thought it really made sense to me when I read that. So for me, I understand that when stepping into our power, it's the ego which gets in the way. But our spirit is ever forgiving, thank goodness, and gentle. So divinity has a transformational power to manifest its own potentiality. It could be called pure magic, manifesting force, divine intention, whatever we choose to call it, we can see it expressing itself in so many ways. It has the quality of light, awareness, being, love. And there's some teachings that say that once awareness, light, being, love arises, divine intention then transforms it in a new way to create a certain kind of space within. This new space, consciousness or universal consciousness, transforms awareness into something new with different properties. The light of awareness is now more of inner light. So in the introduction to spiritual healing course, soul therapy, Ingrid writes, and I'll paraphrase, healing has been practiced for thousands of years before Christ. Early records showed the time when Greeks introduced hygienic therapy, which is rest, fresh air, and diet, as a principal weapon against disease. So nothing's changed there because that's the government guidelines as well, isn't it? You know, eat well, exercise. So, but these are all non-invasives. It seeks the wholeness of the patient rather than its parts. It seeks to bring healing through unconditional love, bringing spirit, mind, and body, emotions into harmony, and releasing more fully the inbuilt curative powers of the body. So it recognizes the source of healing to be divine, universal energy working in and through those who choose to channel it. And as with the work, we do adhere to the same mantra that all doctors have to adhere to, and that is do no harm. Healing is complementary to orthodox medicine. And as a therapist, I'm also aware that we aim to work in cooperation with the medical profession. Healing is accepted by the BMA, and patients can request this. However, as with all therapies, the GP has overall responsibility to the patient. And I always ask my patients to let the GP know that they're coming to see me. Very important. So when I met Ingrid, I just went back home, back to what I'd felt ever since a young child, that sense of the spirit and how I recognized that it got cracked and, you know, I had to get on with life, doing all the material stuff. So Ingrid was offering this space and we had to trust. And that felt quite hard to start with, I will say. But she created a generous and informative space for us to explore the various teachings on offer. She produced a comprehensive handbook, which would help and guide us in a practical way throughout our training. But she also spoke about how soul therapy combines spiritual healing, counseling, psychotherapy, and a range of techniques from the realm of subtle work, energy, with the aim of bringing healing to every level in our existence. I won't go into all of them because actually Ingrid's spoken about them, the long list that she prepared on the back of an envelope, you know, having to do with physiology, anatomy, and understanding the nature of disease, listening skills, chakras. A number of this I was already aware of. For the first week, we looked at Emoto, and I'd never heard of Emoto. Maybe a lot of you have, but Dr. Masaru Emoto, he trained as a doctor of alternative medicine, and in brief, he discovered through extensive research that molecules of water are affected by our thoughts, words and feelings. So when water is frozen, its crystals will either be beautiful or ugly, depending on whether our thoughts are positive or negative. Wow, was my initial reaction, I must say. So our bodies are, depending on age, about 65 to 50 to 65% of water. That's us. So what are we doing to our bodies when we have these different thoughts? And how can we change it? So I did sort of think, well, how does that relate when we're thinking about Zen or Indian Buddhism or whatever? But I thought, it'll all work through. So each week we've been introduced to different ideas and subjects. We were asked to write a paper about something that interested us, and I chose Feng Shui because I thought that's a really interesting subject. I'm still coming to terms with the background, it's pretty hard stuff actually, but having looked at it and thought about the space that I live in, and I actually have a beautiful painting in my living room. I should have brought a picture of it, but that I bought here a number of years ago. And it was it was called The World, and it was painted by somebody who practiced eurythmy, and it was absolutely stunning, and I've got it hanging up in my living room. And I was looking around my room and I thought, okay, I've got to start thinking about how I want to change the energy, how to change what is happening in my space. And then I took it further out to my garden. So now I've got a Japanese garden with I Ching in it and all sorts of things. I'm really happy. But that all came from exploring something that I didn't really know much about, apart from, sort of the odd thing about, don't have dying plants by your front door. So we learned all these different things and the practical uses of them. So one of the things I remembered was about with auras as well, and how we live with it. And I was thinking, oh my goodness, I understand now. As I went with my husband to a Paul Simon concert. I never really liked crowds, but anyway, as we were standing there, and Paul Simon eventually arrived. It was in the country, so it wasn't a huge thing. The crowd surged forward and I went out like a light. Absolutely, I hated it. I couldn't breathe, I couldn't do anything. So I'd fainted and missed the whole concert. And I thought, if I'd known about how to protect myself when I went out, that would have been quite a good thing. So yes, I got agitated, distressed. It's not going to happen again. So my personal space, I will be able to protect. We also think about attunement using breath work, and I regularly do breath work with a group of people called the Alchemy of Breath. So that was rather nice to have that brought in as well. But in every meeting over the 2 years, not only did we get all the basic learning of these different ideas, reverse speaking, auras, attunement, Feng Shui, etc. Ingrid helped us because she gave us personal examples of how she'd worked with something, and people that she knew, and the healing journey. So that was really exciting as well. So it felt so personal. It wasn't just reading something from a manual. Obviously in the first year, we were just little heads and shoulders on the Zoom. So the second year after COVID, we were able to meet each other, and that was wonderful as well, because we were able to meet and pick up on our energy and how we could work together. And when we started bringing clients into the room, then we'd work together with that as well. So We would individually, we would use our counselling skills, help to understand what it was, but as a group, we would be doing the healing. A little bit scary to start with, but we got through. So we were guided on how to connect to our inner light, and most importantly, how to close down afterwards. This could be done with a prayer or whatever way, an acknowledgement of thanks to the divine for allowing us to work. So in this time, I also had questions about what it is in me that can facilitate change in other people. At home, I have on the words, my wall, the words of Viktor Frankl: between stimulus and response, there is a space, and in that space is our power to choose our response. And in our response lies our growth and our freedom. I was being asked to go further. Can I recognize, appreciate, and understand my gifts and trust in the divine? But with the training, I was unable to step into and embrace my power, to understand that we need our ego, but also to recognize where and when it's useful in my work as a healer and practitioner. And Ingrid and my fellow trainees helped me in getting my confidence back as a person and as a healer. So I want to give thanks to Ingrid for her inspiration, clarity in teaching, and the love, generosity and support she's given me. And I want to extend that to my fellow trainees. It's been really a truly generous, wonderful journey together. And I've got a bit of room here as well, Ingrid. Yay! But I wasn't sure where to put it, but it was about how to create that silence, I suppose, or that's what it says to me. There is a voice that doesn't use word. Listen. That's it. Thank you very much.
Hello, my name is Professor Nigel McLennan. Thank you very much for coming along. Can I just endorse everything that Denise and Ingrid have said? It was a phenomenal course, and I think all of us learned a vast amount of information from Ingrid's many years in practice. And I have to say, I hope I can continue to be a mentee of yours for many years to come. Thank you so much. I'd like to run the session on an interactive basis, if you don't mind. So I'm going to ask you to respond to some questions I'm going to put to you. Would you like to know 9 factors that you can use to improve client outcomes? Yes, please. Okay, let me give you the background to this, because it's going to be coming from a place that you probably wouldn't expect. My background is a scientist. And I'm aware I've come along to a meeting of healers, and scientists and healers sometimes are in conflict with each other. I'll give you some background. I took a degree in psychology, experimental psychology specifically, and a doctorate in a field of psychology called leadership coaching. And between the two, I took a diploma in psychotherapy. When I was doing my undergraduate degree, I knew I wanted to do something practical. I didn't want to do what most people do for the undergraduate dissertation, you know, an experiment that's of no consequence to anybody but ticks the box. I wanted to do something that I could actually use in the real world. So I got permission to do a meta study of the factors that determine successful outcomes in counselling, psychotherapy, healing, etc., etc. And you can imagine that that involved a vast amount of reading. It was probably closer to being a PhD literature review than it was an undergraduate thesis, but that was fine. I was prepared to take on that amount of work. And by pulling together a huge amount of information and evidence, I realized that almost all therapeutic interventions have common factors. And those common factors may be more important than in therapeutic outcomes than any treatment method or any specific intervention that we use. So what were those common factors that I managed to unearth from this meta-analysis? I'd like to share those with you. First one, and it'll be very obvious when you hear it, is be interested, be genuine, and avoid negative judgments. Now that was completely contrary. That latter part was completely contrary to what was prevalent at the time. At the time, client-centered counselling was very, very popular. It was everywhere. The Rogerian approach. You must be non-judgmental. You're not allowed to pass judgments. You've got to be non-judgmental. And the literature evidence was saying that is just plain wrong. That is just absolutely not the case, simply because it's a human impossibility. So let me ask you a question that would perhaps demonstrate the ridiculousness of this non-judgmental thesis. Would you let a convicted paedophile babysit your children or grandchildren? And if the answer is no, then you've just conceded judgmentalism, yes? Would you let a convicted fraudster be your PA? The answer is no. You would have to be judgmental. So this non-judgmental thing, it's clearly patently nonsense, but it's not completely nonsense in every sphere. We cannot be expressing our negative judgments with our clients. That doesn't mean to say that we don't have them. We can have the negative judgments. It's the non-expression of the negative judgments that is the real issue. But that was not what was being propounded by the therapists at the time. So that was the first thing, be non-judgmental, non-expressive of any negative judgments. But that only sets the path to by far the biggest predictor of therapeutic outcomes. What is the biggest predictor of therapeutic outcomes? We're in a room of healers. I'm sure you all know this. Come on, give me some guesses. What's the biggest predictor of therapeutic outcomes? The therapeutic relationship, absolutely. The biggest predictor of therapeutic outcomes is nothing to do with technique. It is by far, and it basically clouds out all of the others, overshadows all the others, the quality of the relationship. Why is that so? Because the person that we're trying to help is going to have to open up and tell things about themselves that they've probably never told anybody before. Now, many of you have probably heard this from your clients. Nobody's ever listened to me quite as well as you're listening to me now. Yeah, you've heard this from your clients, and that's the way it should be. If you're forming a really, really powerful, strong rapport with your clients, you should be the best listening experience they have had in their lives. And the literature confirmed that. You know, every study I was looking at that I got hold of was saying something along those lines. The next thing that the next common factor that I managed to come up with was it's got to be a safe environment for the individual to express emotions. Now that's quite different from what was being advocated in some of the popular therapies at the time. One of which was scream therapy. I don't know if you remember that. This was where one would scream and roar and get all of one's emotions out. And if one didn't scream and roar, one wasn't being authentic. You know, it does feel actually very, very good. But of course, that's not what the literature is saying. The literature is saying that the individual that we're trying to help must feel safe to express their emotions. So this goes back to the quality of the rapport. If the quality of the rapport is really strong, if they know that we're going to listen to them and not pass any negative judgments, we're de facto creating an environment in which it's safe for them to express their emotions. The next thing that the literature was saying was provide support and qualified reassurance. Now, let me specify what's meant by qualified reassurance. If someone's coming along to you with cancer, you can't say to them, oh, don't worry, you're going to survive. You don't know if they're going to survive, so you can't provide that kind of reassurance. But the kind of reassurance you can provide is, we will do everything we can to either ameliorate the circumstances or make you feel better, or help you accept it better, or help the journey to another life. In whatever way we can. So you can't reassure them about the health outcome, but you can reassure them about the process. And when people, the literature was saying, when people feel supported and reassured that the process was going to be well managed, that helped therapeutic outcomes enormously. And this is probably not a surprise to any of us. If you look at the literature on the most successful doctors, surgeons, and people who do physical medical interventions, the ones that have the greatest outcomes don't have any better techniques than the others. They simply have a better bedside manner. In other words, they enable the individual to garnish their own resources to heal themselves. Which takes us to the fifth point, which is the fifth common factor, and that is that good therapists, good healers, good practitioners provide a positive expectation and an atmosphere of hope. Now, that doesn't necessarily mean that there's going to be a hope for a cure if it's, say, terminal cancer, but hope that their life is going to be livable in the transition phase. So positive expectation and hope is common to all the therapies. And every single one I looked through had some advocacy of that one ought to provide some kind of positive expectation and hope. The sixth common factor was to provide or enable the provision of, and I'll come back to that qualification in a short while, an explanation of the causes of the challenge that the individual has. Now, the optimum seemed to be if the individual themselves explained what had taken them to where they were. If you could get them to feel empowered enough, self-insightful enough to explain to themselves why they were in the situation they were, that seemed to empower them greater for the next stage in this sixth common factor, which was the provision of a rationale for treatment or intervention or therapeutic help of some kind. So if the individual understood what caused them to be where they are, and it didn't actually matter that that cause was accurate, by the way, they just had to believe that they had an explanation that worked for them, then they were much more likely to believe in a treatment that was linked to that causal sequence. So if there was a disparity between the causal explanation and the rationale for treatment, it generally didn't work. So those two had to be very, very tightly linked. The seventh one was to provide opportunities for the client to experience success. So it could be really simple successes. For instance, you could be the best, meaningful, most authentic relationship they ever had in their lives. And if they understood that was going on, that was a success for them. If they, for instance, were able to identify the causes of, if they themselves identified the causes of their own problem, that was a success for them. So it didn't really matter how the success was provided in all the various therapeutic tools that I looked at, as long as there was some mechanism to provide some kind of success for the client. Positive reinforcement, self-validation, I'm sure you know all of the phrases. And the eighth one was to provide and encourage empowering beliefs. So it probably doesn't matter which therapeutic school or system you use, almost all of them, I would go further, all of them encourage the adoption of empowering beliefs. We're trying to get the client to believe things that are beneficial for them. So the government health advice that was referred to earlier by Denise and Ingrid in passing, that we should be exercising, we should be eating 5 fruit and veg a day minimum. We should be not smoking. We should be exercising regularly. We should be having minimal intakes of alcohol. We should keep our weight under control. All of those are empowering beliefs that governments all over the world try to persuade the citizens to adopt, and therapy is exactly the same situation, the encouragement of adopting beliefs. So, having done this undergraduate dissertation and having got my diploma in psychotherapy, I set off into the practice world to learn how to do it for real, and then started working with clients. So I was working with some very disabled clients who were being discharged from psychiatric hospitals. I'd set up a psychiatric rehabilitation center to take some very, very disabled individuals and try and rehabilitate them to the point that they were able to reintegrate into society with the community care program that was in force in the government at that time. And what did I find? Well, I'd studied all sorts of psychotherapeutic techniques, and I was using these techniques, or trying to, and I'd been qualified, I'd been told I was good at using them. They weren't working. They just weren't delivering. I thought, was it me? Was I not doing it properly? So I got some friends and colleagues to assess, no, you're doing everything you should be doing. Was it the therapeutic techniques? I didn't know. But what I had noticed while I was getting frustrated at not being able to get outcomes, and bearing in mind we're dealing here with people who've been in psychiatric institutions for 20, 30, 40 years, so really disabled, mentally disabled people, I realized that those who were getting better fastest had one thing in common. They were the ones that were taking self-responsibility. They were the ones that were saying, it's up to me. I need to do this. Thanks for your help, Guide, but I'm going to have to do this. I'm the one that needs to control my emotions. I'm the one that needs to control my behaviors. Now, they weren't saying these things to me. They were not capable of saying these things to me, but that was how they were behaving. So I thought to myself, well, all of this knowledge I'd acquired, and the elephant in the room had never been taught in any of the extensive courses I've been on. Not once did any of my teachers say, psychotherapy is down to getting the client to the point of self-responsibility, and here's how to do it. So I realized that this is what I had to do. I had to figure out how I was getting some clients to the point of self-responsibility and others not. What system could I develop, I thought to myself, to get all clients to the point of self-responsibility? Because if I can get them to the point of self-responsibility, I don't have to do anything. It's going to be down to them. They're going to heal themselves. So that was the journey that I started myself on. Took years and years and years of practice, trial and error, refinement, experiments, failed experiments, embarrassing faux pas. This is what happens when you try anything new, right? It's normal, isn't it? And eventually, I did develop a system where I can get, when I say I mean anyone who knows how to use the system. It's not peculiar to me. Anyone who uses this system can get people to the point of self-responsibility and therefore to the point of self-healing between about 20 minutes and in extremis an hour and a half. I've never not been able to get someone who's mentally normal to the point of self-responsibility in an hour and a half. It's always earlier than that. So what I'd like to do is suggest to you, if you want me to, I can come back and I can show you the system. Now, Denise, Ingrid and Tanya, we've shared this, so I've shared it with them, and they can tell you whether or not they think it works, or whether or not they think it's something that you could use in your own practice. But if you'd like me to, I'll come back and gladly explain this system. But in the meantime, with a few minutes left, I'd like to open the floor up to some questions.
Yeah.
Yes, ma'am.
I've been definitely trying to stand down to nothing, so I've been to my legs because I can't turn the sound to nothing. So apologies for being frustrated. The system you're talking about?
Yes.
Yeah, I completely understand everything you said. In your experience, where you have had people through your system that you've given an hour, 20 minutes or an hour to understand and take personal responsibility for their own well-being, what do you do when you come across those individuals halfway through and you don't want to take responsibility because they know or their attitude is fickle or they're not ready yet to do it?
Great question. And just in case it wasn't picked up by the microphone, what system do I use to help individuals who are resistant to accepting self-responsibility? How do you deal with those? Every therapist has resistant clients, right? We all get that, yeah? Yeah, great question. Well, first of all, that was something that happened very early on in this journey. When I realized self-responsibility was the thing, the elephant in the therapy room that had been missed, or I thought had been missed, I realized that some of the clients weren't taking self-responsibility because they did not want to take self-responsibility. That's a more nuanced one. We'll come back to that. Let me get the first one first of all. Okay, so some of the clients did not want to accept self-responsibility. So how do you persuade someone? And it is persuasion we are talking about here. If you come across Jerome D. Frank's famous book, Persuasion and Healing, 1961, published, I think, 9 editions, Persuasion and Healing. If you come across that book, he basically says in that psychotherapy and all akin systems, it's persuasion by healing. We're persuading the client to change their behavior. Now, at no point in that book did Jerome D. Frank say, get them to the point of self-responsibility. He just talked about persuading them to change this, and persuading them to change that. So I knew that was going to be an issue. Some clients were going to be very reluctant to accept self-responsibility. So I developed a little subroutine within the bigger system to get them to take themselves to any given emotional state. So I would ask them to name an emotional state: depression, happiness, anxiety, whatever. And I would get them to that emotional state. I would use these, it would take too long to go through the system, but I'd get them to that emotional state. And then I'd get them to shake themselves off, stand up, walk around the room, and then get them to name another emotional state and get them to that state and get them to confirm that they were in that state. Do that as many times as it took until they would say, I can now take myself, or you can now take me to any emotional state that I choose to mention. So once they're there, the resistance collapses, because not because of what I've said, but because of what they've experienced. So if they can take themselves to any emotional state with a few lines from me, then they know that they can put themselves into. So then the resistance is gone. I've never had somebody who's gone through that subroutine not say, yes, I can engineer in myself any emotional state I choose. So once you're there, you've broken the back of the agency problem, as some people call it. I hope that answers your question.
Well, we'll come in. Yes.
You want to perhaps give it?
Yeah,
Okay.
it would be very good.
Glad to help if you want me to. Yes, sir.
Could you simply ask the patient a one sentence question: are you prepared to take self-responsibility?
That was one of my early trials. An obvious one, isn't it? Which is why, of course, you're asking it, because you're in the place, in the mindset that I was when I was trying to explain this, understand this as well. And I did ask that very question, and I'm fairly sure you can imagine the answer. What do you mean, take yourself responsibility? I'm not the one that caused this divorce. I'm not the one that made me lose my job. I'm, etc., etc. So yeah, if you in script writing, there's a phrase called "don't communicate on the nose." None of the dialogue should be on the nose, which means it shouldn't be head on. So if you say to someone, you know, can't you just take self-responsibility? They're going to give you if they're not going to give you a physical gesture, they're going to give you an emotional gesture that will tell you it's not going to happen.
Can I ask as well? So, this is just from my own experience, recognizing that people, they want to change, they think they want to change, they think they're going to take the responsibility to change. And then I realized actually they do want to be handheld for a period of time in order to learn how to trust, learn how to, that's the therapeutic relationship that comes in. So it isn't always immediate, it is a way of finding the right time. And yes, they might know the technique of go to a happy place, go to a sad place, go to an angry place. But they are insecure in their outside world. So they might be secure in the room with you, but then they go outside.
Yeah.
And it's
Yeah.
so hard.
For the microphone, can I just summarize the question, because it might not be picked up for this. Okay. Denise has just asked. It's all very well for people to understand the theory. I'm paraphrasing Denise. Please forgive me if I got it right. Denise has just asked. It's all very well in theory for people to say that they take self-responsibility, but when they get out into the real world, are they actually practicing that? Do they need a little bit of hand-holding to get to the point where they can actually take self-responsibility? And great question, yeah, absolutely. So how do you do that? Well, the system I use is I get them to rehearse it. So whichever area in their life has been causing the issues, usually related to them not taking self-responsibility for some area of their life, they didn't know that, you know, obviously it wasn't deliberate. I get them to rehearse over and over again various different contexts and various different scenarios and nuances until the point where they're walking out of that meeting, and the meetings can sometimes take 3 hours, maybe 5. They're walking out of that meeting completely confident that they can handle whatever life is going to face them, because they've rehearsed all the scenarios that they presented to them.
I have a question here from somebody who's online.
Sure.
Okay, I'm presuming it's online, so this is from Helen.
Hello, Helen.
And she is asking this. Actually, a friend's son has been in UK mental health services for several years. He has shown no progress, having been treated with enormous amounts of drugs for schizophrenia for many years, and then being discovered he has PTSD. He has been, quote, treated, unquote, with EPT 12 sessions. It hasn't helped him, so he's been given a further 12 sessions. He is being given no opportunity for access to complementary approaches. Any ideas of what I might do to help him? I have another question that's come up.
Okay, cracking, sympathy, wow. Well, as we all know, the mental health services across the world are not exactly the most progressive. I think that's a nice diplomatic way to say it. And ECT, in the hands of any competent psychiatrist, ECT is an absolute last resort. And we're pretty sure that it literally fries parts of the brain. Yeah, it's the thinking. Very few psychiatrists will come clean and admit this, but the thinking goes something like this: that if we fry some of the problematic parts of the brain, then the individual will start thinking differently. You put that amount of voltage across a biological system, and you're going to do a huge amount of damage. There's no question about that. So I'm completely against it. However, there have been cases of last resort where it has worked, and that's one of the reasons it continues to be used.
But he's in a service. So the question here, he has been given no opportunity for access to complementary approaches. Any ideas on what I might do to help him?
Okay.
Or direct him towards?
Sure. Okay. Yeah, you're asking me to give a complex analysis of something I've got very, very sparse information on. Yes, but my encouragement would be to ask for some psychological help rather than psychiatric help, and to maybe ask for some healers. Everybody else in this room has knowledge about this subject. What would you recommend in this situation?
Years, I worked with very severe schizophrenia. Luckily enough, I was just a support worker. I was not medically trained, just a support worker. So I was allowed to actually spend hours with an individual, and I would do all the nice things they wanted to do, like take them out, go for a coffee, go to the shops. Then we started building up that confidence, and then I would ask them, what do you like doing? I used to play the piano. I would get them into the things that they used to do, and somehow I made such good progress.
Every psychiatric ward should have somebody like you in doing what you're doing.
Therapists years ago, but they don't do that anymore.
They
want to do nice things, good things.
For the purposes of the microphone, because it might not be picked up by everyone. The lady has said that she was working as a support worker in a psychiatric situation, and was able to help psychiatric patients by spending time with them, getting to know what they liked, and helping them to gain confidence and trust in another human being, and that perhaps, and I'm adding towards now, that the magic of the rapport that you created with them restored their faith in humanity, and probably gave them confidence in themselves. I think everyone should have somebody like you there. Okay, I think.
From my experience, my wife had schizophrenia that came on in her teens when her parents broke up, and she had ECT there. She was very psychic. I mean, she had half-life recall, she had voices, all sorts of phenomena that psychiatrists would say, you're mad, we need to give you some more medication, or we need to fire your brain a bit more, which is what happened. So I would suggest that in that case, maybe go private to a psychiatrist to see whether they can be assessed, see whether they actually have a real phenomena, as opposed to symptomology.
Yeah, that's the major problem with schizophrenia. We've never found a biochemical cause, a biological cause. There's no known pathogen. Frankly, we just don't know what causes it.
Genetic.
There's a genetic link, but the genetic link's not 100% explanatory. It accounts for about 15% of cases of thereabouts, if I remember the research literature correctly. I think I'm out of time, am I? Yes, I am. Okay, I can answer some more questions. Yep, I'll pass over to Tanya.
Hello, I'm Tanya, and I'm very honored and grateful to have known Ingrid now for almost 10 years. And I'm very honored and grateful to have met Nigel and Denise in the last 2 years and had an amazing time. It hasn't only been study and hard work. We've all had some time together to get to know each other better, and I'm very honored that I have got to meet you. And thank you so much. And the wealth of experience that you have, and the kindness and the compassionate people that you are, you're very, very special. So I'm very happy to be here today as part of the group. And I would just give you a little bit of background of how I came about to be in the course. It was something that Ingrid luckily invited me to, and I was very honored to accept it. And the circumstances when I met Ingrid were very interesting. I come from very scientific background. My parents are both engineers. I have one older brother who they've always felt that doing, maths related subjects, science and everything like that was the way forward. And I graduated in 2001 with an economics degree, and then later with a postgraduate degree in finance. And I went to work in investment banking and private equity. And it was something that I really did enjoy, but the values that you create in your own mind when you work in finance are very different to actually reality, because what you're encouraged by and what you're exposed to is actually not real. So when you deal with money and transactions, it's all quite a surreal topic, and you get motivated by being paid money. And that is something that, again, is not real life, as I came to realize later. And then in 2009, I became a mum for the first time, and that coincided with the crisis of the financial crash of 2007, then 2008, and then that's exactly when I found out that I was pregnant. And some people even thought that that was a very strategically planned event, which in fact it wasn't. And in fact, I was a single woman with, with an unexpected pregnancy that I decided to proceed with. And I had my wonderful oldest daughter, Eloise. And then with a bit of time off, I then met somebody who I had 2 more children with, and we studied together back then. And unfortunately, in 2015, our daughter, who was not even 2 years of age, was diagnosed with cancer. And that was after 4 months of being severely unwell and going from one doctor to another persistently and ongoingly for weeks and weeks, and asking for some answers as to why she was being so unwell. And by the time we got into Great Ormond Street Hospital on that day, and by that time, Sophie was most of the time asleep for weeks, and she was on chemotherapy from about day 4 or 5, even before they confirmed what type of cancer it was, just because it went quite advanced and it was a very serious situation. And it was interesting because on the first day, Sophie was christened in Russian Orthodox Church with the Greek godmother, who was a wife of one of the doctors at that time. And on that first day when we arrived, she came in and she was very sympathetic, the godmother Sophie, and she slipped me a little piece of paper with just 2 things, Ingrid and the telephone number, and she said, "You must contact Ingrid. She will speak to you and she will discuss this with you." And everything was so overwhelming back then, and the chemotherapy started and the potential surgery, because she had a tumor, so it had to be taken away. And so I never got in touch with Ingrid. Months later, it was an aggressive type of cancer, and it was either going to be a success, and the chances of success were 80%. It was either that or things weren't going to go well. And again, quite a fast developing cancer. It wasn't going to be a long time until something would happen. So Sophie did have her chemotherapy, she completed it, she had a surgery, and then within 4 months she relapsed. And then the chances of success, as the medical world presents it, is interesting, because again, you have the 80%, and they fell down to 20% survival for 2 years. And then we went on to, once she had to have her surgeries, etc., because she had to have a lot of her muscle taken out, the chances of walking were very, very slim, next to nothing. And that's exactly when I called Ingrid. That was at the time of the relapse. And when I brought a 3-year-old, having gone through a lot of treatment, who wouldn't even weigh 10 kilos, we were fighting for every 100 grams in her weight, to Ingrid, it must have been a tiny little thing. in my arms, who was asleep most of the time, through most of the sessions. And there was a lot going on. There was a genetic mutation that was found in the tumor throughout her body that makes possibly older people, it was more of an older person's cancer than a childhood cancer, but still, everything, one thing on top of another. It was all very difficult to untangle. And so we went through session after session after session, and Sophie is now going to be 10 soon, and she's amazing, and she does ballet, and she's a fascinating, amazing young girl. And we've recently come in for a session with Denise, who took on the session of my oldest, Eloisa and Sophie, together, and they're amazing. The two sisters are amazing. They're very close, as you can imagine. Eloise had to see Sophie go through all of that, and then we continued with a number of sessions, and then my younger children came, and I've recently had, my youngest one is now 4 years old, and she's just started reception, so I've got 4 children. I'm a mum with 4 children, and I'm a daughter to a mother who went through a critical illness, and this is again when Ingrid stepped in, full on with the help of the spiritual world. So having come from the background of economics, finance, and work in financial industry, and seeing a lot of surreal things that don't really even make sense. They're all like, you know, they do look like you're sort of playing a Monopoly game effectively. And being fascinated by that, I can't deny that it was something that I was good at. And, you know, obviously presenting things to, you know, I was in working in private equity. When you work in private equity, you deal with investors. When you work in the banking environment, you deal with clients, and you deal with a bank, you know, if you're wanting to lend to a particular project or a particular company. So I put a lot of that experience on board. But when I was faced with medical issues that were completely out of my reach or understanding and out of any possibility to help, then I had to accept that what I was there for is to simply help my child, to help her to have the best possible life that she could have every day. And it was actually one of the nurses community nurses who would visit us very often, when I couldn't cope with a lot of things, and I'd say, what else can I do to help her? Because I learned how to do all the care for her, you know, for her wounds and for her lines. She had central lines, one after another. All of that care I did for her, and all the injections that she had to have, I've done that all for her. And it was interesting how she accepted it all, and she almost felt that she needed that help. And it was wonderful to be acknowledged as her mum, but also as her helper by the medical professionals. So by the nurses. So when they would come in, they would say, we'll watch you. And at some point they didn't have to be there. So I could do a lot of the things myself. So they had to supervise me at the beginning, teach me, supervise me. And then, so a lot of the medical things I was able to do for my daughter. And one of the nurses said that you can't control the outcome, but what you can do is you can make her happy every day, which you do. And she said, when I look at her now, she's smiling. She's a smiling, happy child. She's got her mommy next to her. And so that's what I thrived on. So when I met Ingrid afterwards for my journey with Sophie, when Sophie was already in remission and doing beyond any of those expectations that the doctors were able to place and quantify, I had to work a lot on myself and how I perceived the world. Because through those 2 years, and I have to remind you that the council was very aggressive, so it was either going to be treated back then and you know, or it would have also finished back then. So it would have been very, very fast. So learning those 2 years, and still it all took 2 years with all the tests and everything, all the chemotherapy, and she had another round of chemotherapy and another surgery, very complex surgeries. So I had to learn to live each day at a time, and then to come back to reality and thinking, well, actually, it's not each day at a time anymore, because tomorrow will come and tomorrow will bring new things. So having to cope myself with what I had to cope as a mom of, at the time, already 3 children and now 4 children, has been something that Ingrid had to reteach me, almost the basics of how one comes back to reality and lives your day after day after day. And that was my journey. I wanted to touch on something that Nigel mentioned, is to be able to quantify success, a medical success, and being able to help as a client on the emotional level. How do you quantify success? What I found fascinating, and I don't have an answer to that, and I'm still also learning and trying to understand everything myself. What I have learned, which unites doctors and spiritual world healers is that it is not in your hands. And as Ingrid says, and we've all said it, I think, in one way or another, that we don't let our ego get in the way. So I think that really does unite the medical profession, because they don't have things, they can't control things. What I found also interesting is that throughout the illness of my child, and then later on, I will finish off my history and my background with my mother's example most recently. You hear a lot that there is a percentage that somehow doctors can quantify the chances of success, which I find is absolutely impossible to do. And it's interesting how they come up with these numbers, because when my child had 80% chances of being successful in her treatment, they went to nothing, because from the moment when they said something is wrong with her, and I kept going on for about a month, I knew something was not right, because I felt it as a mom. She was not behaving the same. They said there's a relapse, and her chances, they had to put me in a room and they said your chances of survival are now 20% for the first 2 years, and there will be significant more surgery, significant more chemotherapy that she might not actually be able to even accept, because her body might not be able to cope with it. So how do they quantify that? That is the question that I don't know an answer to. And then similarly, there was one example, and this is just to finalize my point of how we connect the spirituality and medical professions. And I think there has to be a lot more connection going forward, which I think would really improve everybody's chances of success. And it certainly has improved two very special people in particular. So in my mother's case, on the 21st of February 2021, she was admitted to hospital. I brought her in because I felt that she wasn't feeling well at all. She was a cardiac patient for a long-standing period of time. Something was not right. And we noticed that one of the measuring of the saturation was really dropping, and her blood pressure was dropping. So when I brought her into Chelsea Westminster ICU, they immediately admitted her. The diagnosis wasn't certain to start with, and the morning on Monday they called me up and they said they put her into an induced coma. And again, they said the chances of her coming out of it is 50%. I don't know where the chance is coming from, but it's amazing to see how they bring these numbers in. Whereas in our profession, I believe that we wouldn't say we can promise you anything, and this is something that is actually very reassuring, having been on the receiving side of it. When you're told that I cannot promise you the outcome, is actually very grounding, because you don't chase your 50%, you don't chase your 80%. You're actually dealing with the reality that somebody's unwell, and that's what you're having to cope with. And that has taught me a lot. And so in my mother's case, 2 weeks later, they after she was in an induced coma, and I did speak to Ingrid very early on this occasion, and Ingrid remembers that moment when I approached her. What did I say to you, Ingrid, when I called you? May I ask you, do you still remember that moment when I called up and I said, I did say, Ingrid, please help my mom. I said, please help. They didn't know the diagnosis, and 2 weeks later they found out that she had fecal peritonitis, so she had a perforated intestine. And throughout those 2 weeks, that retrospectively, when they looked back, she shouldn't have even survived, despite all the antibiotics, despite of everything. She shouldn't have survived for 2 weeks until they actually diagnosed it. But there was Ingrid on the other side of the phone for me, available at every point in time, and you've made an enormous effort to be available for me, and I'm very grateful for that. Every evening we had a session, and we discussed things. And for those 2 weeks, unfortunately, I wasn't even able to visit because it was COVID time, so they would only show me my mother on video. And so at the 2 weeks when I was supposed to go and visit her, that's when they confirmed she has fecal peritonitis. They wheeled her into the surgery straight away. And that first night they said, even though we've done the surgery, she probably won't survive this night. So I mean, we're talking about, again, the doctor's giving you 0 chances of survival by the end of that morning. She pulled through that night with a lot of help, and with a lot of help from Ingrid and the person that Ingrid mentioned initially, who set her interest off in the spiritual world. So she was also, could I mention where she was in terms of in Australia? Yes. She was on the night shift in the spiritual ICU, helping gather all that energy, as I can understand it, to try to help that woman who was my mother to pull through so that the doctors can help her, because the doctors weren't able to say that she will pull through that night. And in fact, they were saying she wouldn't. So by the morning, she's still there. And in fact, 4 months later, She left the ICU after 3.5 months in induced coma, with multiple surgeries to come. After each surgery, after surgery, she would be told that she might not make tonight, she might not make tonight. And when I look back and we go and see the doctors who she's seen previously, they absolutely cannot believe that the person who was there on the operating table in the ICU, that she's a person who's now walking and talking, and her mind is very much there. And this is something that I cannot fully describe how it happened, but I know that it happened with the help of both the medical profession and the spiritual world, and being able to channel the energy for her to pull through something that, in fact, even comparing it with my daughter, the chances of my mother surviving once they realized what their diagnosis was were practically next to zero from all the doctors. So this is something that definitely stimulated my interest in the spiritual world. And in fact, digging further and further deeper inside, we then came to discuss this in our sessions, that my grandfather, so my grandmother on my mother's side was a doctor, and my grandfather was completely the opposite. He was a healer, because he spent 2 years of his young age of 12 to the age of 14 with the traveling gypsies, with the Roman gypsies. And he picked up on quite a few different things. So having the union of my grandmother, who was a doctor, and this wonderful gentleman, who must have had something to be able to help, because people did come to him later on in life for various things, for pain and for various problems. So that must have set off somehow my subconscious interest in it all the way throughout my childhood and my studies of economics and finance and accounting. But here I am, a mother of 4, you know, very grateful daughter, because my mother is around, my dad is around, and there is something to it that we certainly need to acknowledge, and something that we can tap into and try to allow the spiritual world into our lives more, and allow it into the medical world. And there was something, I think, very special that I will finish my my part of the story, is that we were very lucky with my child, because the oncologist that we had, we did have private medical insurance who helped to treat Sophie after she was first admitted into Great Ormond Street Hospital. And the amount of trust that I had in the oncologist was enormous. And having that trust, as I think it's all come up again in our discussions today, was absolutely crucial in that outcome of success, I think. So once you find somebody you fully trust, I think it will empower you to do the right things. But it was also something that he said to me when I brought it up, and I explained to him that we are going to see a spiritual healer. And he said, because at that time I was already seeing it, I said, we are seeing a spiritual healer. And he said, whatever you're doing, please keep doing it, because he said, at the moment, things are looking good. And we weren't expecting that. This was way into the relapse and the treatment after the relapse and the following surgery. So he said, please keep doing whatever you're doing, because it is helping. This was from the medical side. He said, we couldn't promise you anything. It was not something that they could explain. And also, interestingly enough, at Great Ormond Street, there was also a disconnect with my previous partner, who was the dad of Sophie and Leo, and we now share the time with Sophie and Leo. But it was very interesting, because I feel we were lucky in both the NHS and the private hospital that the recognition of something beyond what medicine has to offer was always there. So when my previous partner, or my ex-partner, mentioned it to the doctors, to the consultants in Great Ormond Street, he said, well, my wife, my partner, thinks that it could be anything to do with bad energy, because I must have said it, I must have voiced it to him at some point. And then he said, what do you have to say to that? And he looked at the consultant, hoping that he will say, well, that's all nonsense. He said, well, that is the only explanation, because he said, we don't have an explanation for any childhood cancer, why it happens in the medical world. So he said, there must be something to it. And he was so grounded, he went like this. He thought, well, that he couldn't speak to them anymore for a while, but that was something that I've encountered. So thank you very much for listening. I will go back to my script, and I will.
Any more questions? Thank you so much for a wonderful talk.
No more questions. And there was one question. for more for earlier, which is from Pellegrin.
Ingrid, can I ask you to come up to front of the purpose of the video and the focus, that'd be lovely.
I don't think we've got it. We were talking about responsibility, personal responsibility. I think you mentioned that somebody might know more, contact you. The question is, yes, please, would love to learn more about self-responsibility if you come back to this. Thanks. You've got about 9 years of time to explain that.
Okay, just a brief resume, because people are invited to come down, go downstairs to the cafe, we'll all have tea together.
Okay, I think you can understand how much I love these people, how proud of them I am. They're all so different in their own ways, and they're powerful healers, and they're going to do so much good in the world for everyone they meet. And my thanks to them, my thanks to you for listening, and let's have some tea and biscuits.
Thank you very much.
Thank you very much. Yeah. Thank you.
Oops, sorry, but just
Yeah.
Thank you.
Yes, perfect, thank you.
Thank you.
Thank you, Zoomers.
Charlie, this here will take it.